Thinking about your skin health but not sure who to turn to? Well, let me introduce myself. Hi, I'm Dr. Mara Weinstein. I'm a board-certified dermatologist with a passion for helping people feel confident in their skin. I became a dermatologist because I've always had a love for helping people feel better about the skin that they're in. We always say you want to look as young and as good as you feel. And many people, even though they're getting older, we always say age is just a number. It's really not about your age, it's about how you look and how you feel and how you present yourself. Because when you walk into a room, you want to exude confidence. And when you have that confidence, it helps land you better jobs, it helps you network, it helps you make more friends. There's so many different reasons why you should look and feel your best across all decades. So let me tell you a little bit about my history. I grew up on the small island of Guam in the Pacific Ocean. Now, even though Guam is a US territory, it's a place that has very limited resources. As a child growing up, there were no dermatologists on the island. And so when my peers suffered from common conditions like acne, warts, or different sorts of rashes like eczema and psoriasis, there were no dermatologists to treat and attend to their conditions. Oftentimes, if there were concerning lesions like something that looked like a skin cancer or a new growth, the doctor would have to take a biopsy and send that biopsy all the way to Hawaii, which is 8 hours away from Guam, in order to get a read on the true nature of the spot. And so growing up in this environment, I knew very early on that I wanted to be able to provide a service that wasn't available to me as a young child. What's more is that I absolutely loved skin. I was fascinated by all the different cultures and all the different textures and skin conditions and colors that I was exposed to on the island. Really, Guam was a cultural melting pot, and so there were people from all over the world who had come to the island. They might have come as part of the Navy base or the Air Force base. They might have been a local family. Again, melting pot of different cultures, different skin types, which presented with many different skin conditions. As a young girl, there was one skin condition in particular that I struggled with, and that was acne. And so I searched for hours and hours on the shelves at our local drugstore looking for products to help. Again, there was no dermatologist to turn to, and at this time there was also no social media. And so I really did my best to try to take care of my skin. As I grew older, I realized that skincare was something that I was really passionate about, and I wanted to delve deeper into that field so that I could not only help myself during this vulnerable time, but I could learn enough to help others and spread my knowledge. As an island girl through and through, it was a little scary to leave Guam, but I was excited to explore the big wide world that awaited me. We moved to the US mainland for college, and I finished my 4-year college degree at Princeton University in New Jersey. I then went on to do medical school, although my path to medical school was certainly not straight and narrow. And this is not uncommon. They don't make it easy for people to get into medical school for multiple reasons, but one is because you have to pass standardized testing exams like the MCAT. Now in Guam, where I grew up, standardized testing wasn't really a thing that they stressed or enforced, and so we didn't grow up constantly being exposed to standardized tests. So when it came time for me to take the MCAT, I really struggled with that. But I also knew that I wanted to go to med school, and I was so focused on fulfilling this goal, I applied to med schools all across the country, and I got into one called the American University of Antigua. The American University of Antigua offered a medical program to get your MD degree while living in Antigua for the first 2 years, yes, Antigua and Barbuda in the Caribbean, and then spending the second 2 years of med school in the United States, rotating through various hospitals. So I got to Antigua, I studied as hard as I could, and I ended up being the top student in my class after that 2-year time period, where then we had to move to the States to complete the rest of our medical rotations. At this time in Antigua, I also ended up meeting my current husband, so I know that this path was the one I was meant to take, and it will probably be different for everybody watching this video. After moving to the States, I realized that being a student of the American University of Antigua was not working to my advantage, and actually people in the US hospitals were quite rude about it, asking questions like, why is an educated girl from Princeton like you going to a Caribbean med school? You know, why did you take this path? And honestly, at the time, it was very hurtful. It hurt my self-confidence. I didn't really know how I ended up there, but all I knew was I was getting an excellent education and I was working so hard to do the best that I could. So at this time, I actually transferred schools. I ended up getting into a school called the Northeast Ohio Medical University. Now, this university was close to Akron, Ohio, and so we packed up all my things I was living in Atlanta at the time, and we moved to Ohio to start a new med school. Luckily, during this time, I was already onto my clinical rotation, so I was quickly able to integrate right into the hospital rotation system and make new medical school friends along the way. It was at this point where I really leaned into pursuing my passion to do dermatology. And in doing so, I found some key mentors along the way that helped guide me and impart knowledge onto me of what I needed to do to achieve my goal of getting into a dermatology residency program. Now, you may or may not know, but this can be a really difficult process. Dermatology is one of the hardest residencies to land a spot in. And there are very few dermatologists across the country. In fact, there's a deficit of dermatologists, which is why, A, it's really sad that we can't train more dermatologists, although I believe our specialty is working on it, but B, there's limited access to dermatologic care, which is why making these videos is so important so that I can help you, my followers and subscribers, learn as much as you need to know from the comfort of your own home before having to try to find a dermatologist in your city or your town. After working really hard and working with my mentors to figure out what programs made the most sense for me to apply to, I ended up getting a spot through the match at the dermatology program at the Cleveland Clinic in Cleveland, Ohio. It's there where I spent 4 years really delving into the science and learning as much about the field as I could so that I could prepare to take and excel at my dermatology boards. After 4 years of residency, there's a dermatologic board exam, which all dermatologists need to pass in order to become a board certified dermatologist. And that title is no small feat. Just know that if you're seeing a board certified dermatologist, that doctor has taken 3 exams to even get into medical school, and then another 1 or 2 exams to become board certified. All in all, it's a total of about 12 years of schooling if you count 4 years of undergrad, 4 years of college, 4 years of internship and residency. And then if you decide to do an extra year, which I did, a fellowship, it's an additional year, which makes it 13 years of education to be able to do what I love the most, which is educating my patients and help you feel confident in your skin. And really, this is what keeps me going, because every patient I see on a daily basis, I try to impart some knowledge so that they can take that home with them and take better care of their skin. And if they have questions, they know where to turn to. Which brings me to my approach to skincare and health. Like I said, I see patients on a daily basis. I work full-time inside and outside of the clinic. And when I enter the room, whether I know the patient or not, I do my best to provide personalized care with a holistic approach. What that means is when you come to see me, I'm going to ask, how can I help? What brings you in today? What are your skin concerns? And we're gonna look together in the mirror and go through all of the questions that you have so that I can help you learn more about what's going on with your skin as you get older, or if it's your child, or if you're developing acne. It's my job to really help clarify the processes that occur in the skin as we age. One of the most common things I get asked by patients is, why do I recommend certain types of skincare, or why do I recommend certain types of lasers? And I always start from the basics. There is evidence to show that this device or this skincare ingredient is best for your specific skincare concern or is safe for your specific skin type. When I see patients, I provide an individualized plan because every patient is different and every skin type is different and every skin tone is different. And therefore, people will react differently to different products and procedures that are recommended. And I can't tell you how many complications I've seen just in this past week of patients who have been to med spas or providers who maybe didn't have as thorough of training. And unfortunately, I'm having to clean up messes and complications and scarring and things that these patients did not realize would happen when choosing somebody to perform the service who was not as educated, or perhaps had just taken a weekend course to learn about how to operate a new device that was just purchased in the practice. And this is not an uncommon thing that happens. I mentioned earlier that I talk to parents who bring in their children for skincare concerns. I'm a true believer that skincare should be discussed at every age, including babies, pre-adolescents, teens, tweens, young adults, etc. Everybody should have some grasp on what sort of skincare they can and they should or shouldn't be using. And so let me tell you a little about what you should expect when you come to this channel. First off, there will only be real talk on skincare and healthcare, evidence-based recommendations, and evidence-based treatments that we use day in and day out. I also give you breakdowns of trending treatments, and we'll delve further into what works and what doesn't, where you can save and where you can splurge. My goal is to give you education that empowers, not overwhelms. So thank you so much for joining me on this journey. Whether you're new to the skincare world or you've been battling acne for years, worried about hair loss, or just want glowing skin, I'm here for you. Let's build the skincare community together. So make sure you subscribe and comment with your biggest skincare question below. Thanks for watching.